I'm joined today by three of my colleagues who are actually local from Texas and Oklahoma, and we wanted to touch on face surgery. One thing we know is gravity always wins and time keeps on ticking. So if we had to pick one face procedure or one face surgery, non-surgical, the biggest bang for your buck, what would it be?
If it was a facial procedure right now, with the way we're all wearing masks, I would say the eyes have it. I would say do a blepharoplasty if we're talking surgery.
The window to the soul, huh?
Yes.
Yeah. Okay, I like it. What about you, Dr. Camp?
I think that facelift surgery still for me is the biggest bang for the buck, just because the way I think of things is what's the patient going to do over the next 10 years? And I feel like we age in more than one way. We lose volume, we lose skin tone, and we can do those things surgically that will hold up. When you compare that to filling and lasers over the same period of time, I think surgery actually is the gold standard and stays that way. At least that's what I think and that's what I see.
Yeah, for full facial rejuvenation, I agree. I think this is a little bit of a trick question because I do think bang for the buck, probably blepharoplasty gives you the best bang for your buck. But overall facial rejuvenation, I think that I agree with Steve, like facelift is still the gold standard, but I'm gonna add this one. What if it's a guy with the loose turkey neck? I love to do a direct neck lift and get rid of that for them, and it's an excellent bang for your buck kind of procedure. So
especially now in the Zoom era, right?
Yeah.
Because you're seeing a lot of the necks. I mean, obviously going out and about, your mask covers a bit, but in meetings, there's still a lot of between the eyes and the neck. Okay, but you're not separating them out. You're going full throttle, as we say, huh?
Well, I think, I think that there's no question there's full throttle, and we live in this age of immediacy, and we see these great results on things like cheeks and lips that are done in the office in 15 minutes. The appeal is obvious. But we see these results in the chair. What happens when the shine wears off? And I think that's where facelift surgery actually comes out ahead. And I'll go one step further, similar to what Dustin's saying. With men, we're seeing an uptick in that. And I think that this idea that things are on Zoom, you're seeing it, it's kind of a lapel lift is what I describe it to as my patients. And the procedure he described is kind of quick and direct. You can't really do that on women because there's no bearded skin. So it's a really excellent way to do a lot for a patient in a short period of time. And so the reality is not everyone wants surgery, and that's okay. And we're supposed to be empathetic, listening to our patients and deliver what they need when they want it. But at the end of the day, they just have that in the background. And so it's nice to know that that's there.
Yeah, and not only are we supposed to listen to them, but also we're supposed to guide them.
Right.
And kind of lay it out for them. I think that's the best way. Give them the options and then let them decide.
I mean, when you guide them, you're listening to what their concerns are. Because every patient comes to you with a different budget, different concerns. And so when we talk about bang for their buck, that you have to be able to address their concerns successfully. And they may choose to do the eyes today, and then they may say, I'm saving for my facelift, and I'm going to do a facelift in 3 years. So I think every patient has to space it out how they want.
But bang for the buck.
Bang for the buck facelift, I'm sticking to it.
All right.
So there you have it. 3 local surgeons agree the biggest bang for your buck in facial procedures is the one that's tailored directly to your requests and needs. For more information on this and other topics, go to theplasticsurgerychannel.com.